during the first wave, some people may have thought at the time, I don't care about getting infected by COVID. I want to go see my grandmother. But at the time, the government said, you don't get to make that choice as an individual. There are restrictions, and everybody stays home because now we have to protect the community. Then came the vaccines, and the government said, we're not going to force you to get vaccinated, but if you choose not to, there will be restrictions. You won't be allowed into a restaurant, a hotel, you can't take a plane, you can't take a train. Now we're lifting these restrictions, and people get to make their own choices again because the balance between freedom and public health has shifted, actually partly because the majority is vaccinated, and most people who get COVID don't need the hospital, so the healthcare system can cope and treat everybody. So now we're lifting these measures, but we know that if you chose not to be vaccinated, you're putting the majority who are vaccinated at higher risk. And that is something that all those who up until now made the decision not to be vaccinated should really consider.
So what's the moral imperative here? What are you suggesting? Are you suggesting that there be more public health mandatory guidelines, or are you just trying to convince people to make the right choice?
I joined you tonight exactly in order to convince people to make the right choice. Look, we cannot keep public health restrictions forever. Even when they were instituted, they were meant to be temporary, and now things look better, the numbers are better, so there's no more an ethical justification to keep those burdens on individual freedoms in place. However, we have to remember what the price is. Think about it. If you're entering a restaurant right now and you don't have to show proof of vaccination and people don't wear masks, you may feel great, I'm back to normal, I can live my life. But what about elderly people? What about people who are immunocompromised or who have young children that cannot be vaccinated yet or have comorbidities? Anyone who's vulnerable to the COVID infection now feel that they're excluded from these indoor public spaces because the risk for them has increased substantially once everybody can go in without a vaccine and without masks. So particularly now that we're lifting these restrictions, I think the moral imperative on us as individuals to make the right choice and to be responsible and to care for each other has increased. So what am I calling for? If you're not vaccinated, go get the vaccine. It's not too late. You can still save lives and help the most vulnerable in our communities. And if you're not vaccinated, at least keep your mask on, even if the government is not forcing you to do it, because that's the least you can do to protect others.
So are you saying that the government is right to just kind of pull out of all of this and say, hey, everyone, it's up to you?
Again, we can't keep these restrictions forever. When is the sweet spot that we've changed this delicate balance between freedom and public health benefit? It's very hard to tell, and it depends on the numbers. Again, if our healthcare system can cope and treat everybody, not just COVID patients, but everybody without delays, without postponing surgeries, without waiting for a bed in ICU, it's time to lift the measures gradually. But if we don't act responsibly as individuals, we might be facing increase in numbers and give the government justification to reinstate the restrictions. So we have to do our parts individually and make wise, responsible choices to keep this level of freedom that we're now beginning to taste again.
It was really interesting to get your insight tonight. Thank you. That is Vardit Ravitsky, a professor of bioethics at the University of Montreal and the Harvard Medical School. She joined us live in Ottawa.